Mostly these are pregnant women who have already encountered eye organ pathologies. If there are indications for a cesarean section, then I understand that this procedure can be done, and then there will be no indications for a cesarean section. Children go to school and they already know what exercises need to be done, how much we work and how much we rest. So for them, it's all just automatic. You see how everything depends, everything is interconnected. We also recommend that if each doctor will recommend and examine not only their own field of vision but also look at everything, it will be a more comprehensive approach to the patient. Considering the work with gadgets and computers, I noticed that my vision is deteriorating, and they examined me with a dilated pupil and saw changes on the retina. Earlier, everyone really wanted the cesarean section. Now everyone has become wiser and understands that this operation can have consequences and complications. I've had it happen more than once that children come, deceive, show lower vision so that we prescribe glasses because all their friends have glasses and only one does not. Our viewers need to know whom to contact so that the doctors are professional and can provide good modern help. Because everything is changing a lot in every profession. Hello to all our dear viewers. Today we are at YUZKO Studios, as always, at our magical location, and we will talk about a topic that is quite rare and not widely available on the internet, because we will discuss pregnancy and vision ophthalmology. And today, our guest is Olha Myroslavivna Natsiuk, a perinatologist, a doctor who works with pregnant women, and Tetiana Bohdanivna Sykyrytska, an ophthalmologist who deals with vision. Please introduce yourself and we will start our conversation.
Good day to everyone. I am the medical director of the Visium Clinic, as well as an associate professor of the ophthalmology department and an expert in pediatric ophthalmology. And today I will be glad to answer the questions that interest you.
Great, please.
Hello, I am Natsiuk Olha Myroslavivna. I'm an obstetrician-gynecologist, perinatologist at YUZKO Medical Center. I mostly handle pregnancy management.
Yes, these are our leading specialists from the Chernivtsi region. Please pay attention. They will tell you all the information, debunk myths, what a pregnant woman needs, doesn't need, how pregnancy affects vision. And the first thing that interests me a lot, some patients are preparing for pregnancy. Actually, not just some. A large number are already preparing for pregnancy at this moment. And of course, the very first period before planning a pregnancy, should one check their vision?
Of course, nowadays vision problems are very common, so it's worth getting checked before planning a pregnancy, especially if there are general diseases such as, for example, diabetes, hypertension, bronchial asthma, allergic diseases. It is advisable to check your vision and then plan a pregnancy, because if there are any problems, we can treat them in time and prepare the woman for the planned pregnancy.
Is there a difference between treating a pregnant and a non-pregnant woman?
Yes, there are more, of course, some restrictions. We cannot use all medications during pregnancy, therefore it is necessary to prepare for a planned pregnancy.
Olha Myroslavivna, what percentage of women come to you already examined and have checked their vision before planning a pregnancy? Are there such pregnant women?
Tetiana Bohdanivna. Mostly these are pregnant women who have already encountered eye organ pathologies, meaning those who have had disorders, myopia or other eye diseases. Operated patients concerning the eyes well before pregnancy, maybe 80% of them are examined. Out of the total number, about 25 to 30% out of the total number of pregnant women, healthy women who have never experienced any issues with their vision organs, quite rarely go for routine eye exams to an ophthalmologist. Rarely, but during pregnancy in such women, well, in fact, in 70%, we diagnose disorders of the visual organs, which quite often require interventions during pregnancy.
Radena Rizina. And do pregnant women have complaints, or do you refer them to an ophthalmologist routinely?
Tetiana Bohdanivna, we refer to an ophthalmologist when a woman complains, mainly in the presence of complaints, or if there are pregnancy complications, or if there are any chronic accompanying diseases, which Tetiana Bohdanivna already mentioned. These include hypertension, diabetes, autoimmune diseases, allergic reactions.
we definitely refer them. It should be a scheduled ophthalmologist examination.
Or if there are pregnancy complications, gestational diabetes, which is very common, gestational hypertension, preeclampsia, when we need to assess vision to see if there is any impact on vision, and to develop a management strategy for both pregnancy and childbirth, because this is very important.
Radena Risina, there is a myth about childbirth. There is such a myth, and I have heard that people specifically go to an ophthalmologist so that the ophthalmologist writes down a vision impairment to have a cesarean section. What do you say about this?
Host, yes, of course, people do come to us, but actually that's incorrect. It's really advisable to prepare for a planned pregnancy, and I would say the examination should be around the 12th to 14th week of pregnancy, and also at the end, approximately the 30th to 32nd week of pregnancy. Then we can notice significant changes and start treatment. For example, if the patient needs to undergo barrier laser coagulation, it is advisable to do this before the 35th week. When can such changes occur? If a patient has myopia, nearsightedness of a high or medium degree, the eye is stretched and there are risks of retinal dystrophy, which can later lead to retinal detachment. Therefore, we can prevent such complications if we perform barrier laser coagulation of the retina.
Radena Risina, to also tell us a little in your own words how it happens, because not all ophthalmologists here look at it in a way to explain how critical it is and how it is conducted, what this procedure is.
Host, the procedure is painless, but the patient needs to be thoroughly examined. We definitely instill drops to dilate the pupil so as not to miss minimal changes on the retina, and we examine it using a special lens. If we see changes on the retina, it doesn't necessarily have to be high-degree myopia. Sometimes such changes can occur with low-degree myopia and even in completely healthy people. If we see changes, we prepare the patient, a procedure is performed, under local anesthesia, drops are used to dilate the pupil, and then we perform laser coagulation of the retina. Vision will be neither better nor worse, but in this way we will prevent complications that might have occurred during a strong period.
Radena Risina, so this needs to be done in advance if there are indications for it.
Host, if there are indications, of course. There are very few such patients, so we use this method very rarely. Host 2, but the examination must be complete, comprehensive, with a full assessment of the retina's periphery.
Host 1. Does this procedure not harm the pregnant woman or the new mother, the future mom?
Host 2. No, it is absolutely harmless, this procedure, and painless.
Host 1. Interesting. Host 2. Host 1. And tell me, is it so that, for example, if there are indications for a cesarean section, then I understand that this procedure can be done, and then there won't be indications for a cesarean section. But what if, on the contrary, patients want there to be indications and want a cesarean section? Are there such cases?
Host 2. In fact, there are not many indications for a cesarean section, very few. This is, let's say, hemorrhagic retinopathy, meaning hemorrhages on the retina, rare retinal detachment, fresh trauma or burn, and an acute glaucoma attack. Also dystrophic corneal diseases, such as an ulcer, where there can be serious complications and loss of vision. But I repeat, there are very few such patients, so we always consider the indications. We can write down the changes in the patient from our side, but the decision is still made by the gynecologist, taking into account the overall condition of the patient.
Host 1, probably all together, right?
Host 2, yes, we have to consider everything together.
Host 3, yes, we act according to the orders of the Ministry of Health. Yes, and indeed, in our order number 8 about cesarean section, there are clear points that indicate the reasons for a planned cesarean section, including those related to vision. Tetiana Bohdanivna listed these 4 indications. So previously, severe myopia was also considered an indication for a cesarean section. That was earlier, now it is not considered.
And I also have a question. If laser coagulation of the retina was performed after the 35th week, well, at 36 weeks, the woman at 37 weeks could potentially go into labor. Is this a contraindication for vaginal delivery?
Host 2. No, this is not a contraindication if boreal laser coagulation has already been performed. We have considered all the risks and there will be no retinal detachment.
Host 3. So it's safe. Women need not worry if they had laser coagulation and they might have premature labor. Well, for other reasons, right? But it happened that coagulation was done at 34 weeks and at 35 weeks the woman gives birth. So she shouldn't worry.
Host 2. There's no need to worry, but it's still advisable to have checkups in the 12th to 14th week. Then we can timely carry out all the procedures and not delay until the last moment. Also, some of our patients confuse excimer laser vision correction with barrier laser coagulation. And we always explain that this is not for vision, because excimer laser correction is performed to improve vision, to eliminate myopia or astigmatism, and barrier laser coagulation is to prevent retinal detachment. And by the way, about excimer laser correction, our young patients often ask whether they can give birth afterward, whether natural childbirth is possible. Are there any risks? There are no risks because we have already listed the indications for a cesarean section. Excimer laser correction can be done before pregnancy. During pregnancy, it is still not advisable to perform it, but there are absolutely no risks.
Host 1. And before pregnancy, if it's also a planned pregnancy, if it's planned, if the patient has come because she knows she already has some issues or for an examination, then it can be done.
Host 2. Yes, we can do it at the stage of planning pregnancy and it can be a natural childbirth.
Host 1, understood.
Host 3. Well, it's really important to examine the patient twice at the beginning of the pregnancy. So we have a start, a background, and at the end of the pregnancy. By 36 weeks, we should have the delivery question settled. Alla Redko. That is whether the woman should or should not have contraindications, including from the eyes for childbirth. And in my practice, there was a case when at 14 weeks, the woman had myopia. So there were no indications for laser coagulation, but at 34 weeks, we went for a follow-up examination with the ophthalmologist. The woman had gestational hypertension and indications for laser coagulation appeared and it was performed. The woman successfully gave birth and it was conducted at 35 to 36 weeks, it seems.
Marina Bahinska, did the patient give birth naturally?
Alla Redko. No, the patient did not give birth naturally. She delivered by cesarean section because there were other indications for it, not related to vision. But there was such a case where at the beginning of the pregnancy, the situation was one way. And by the end of the pregnancy, the situation with vision changed because there were certain pregnancy complications.
Marina Bahinska. Therefore, it is indeed advisable to check again both at the beginning of pregnancy and closer to the 35th week. Then I have the next question. We all know that you work at Visium and they have very good equipment there. We also have equipment in our office, everything needed to check vision properly. But very often we encounter and see the work of ophthalmologists who only work with a chart. And additionally, I think lenses or something like that. But there are no devices to check everything. Is the ophthalmologist's conclusion about the pregnant woman reliable if they don't check so extensively, just the vision and that's it? I am interested in this as a gynecologist, for example. Do you know why I ask this question? Because gynecologists also often just examine without doing an ultrasound, and this is also considered a gynecological examination. But I understand that without an ultrasound, we cannot properly examine a woman. This is a question for ophthalmologists.
In Bakulina, yes, of course, it's better to conduct a comprehensive examination. Because even in an absolutely healthy woman, there can be changes in the periphery of the retina that we cannot see with ordinary methods. Therefore, optical coherence tomography is recommended. It is absolutely harmless for a pregnant woman. This way, we can detect even minimal changes and start treatment in a timely manner if needed.
In Bakulina, therefore, it is advisable to undergo a comprehensive examination. Please tell us more for pregnant women, for everyone, so that everyone knows what drops you apply, what are the restrictions, what is needed if a woman is indeed offered to use these drops.
Yes, we use drops to dilate the pupil. To prevent any effect on the body, we suggest the patient hold a finger on the tear duct area to ensure the medication does not travel through the tear ducts and acts only in the eye area. This medication dilates the pupil for only 2 to 3 hours, but without dilation we cannot always see. Through a narrow pupil, it is impossible to examine the periphery of the retina, so we use drops to dilate the pupil.
Marina Bohinska, understood.
Inna baculina, unless there are contraindications, for example, glaucoma. It is strictly forbidden to use drops to dilate the pupil. In such cases, we examine with a narrow pupil, or the patient has had surgery, or there was an injury. Well, here we proceed based on the situation we observe, but still it is preferable to use the drops.
Marina Bohinska, tell me, have you tried? Did they put drops in your eyes? Marina Bohinska, and they tried it on you too, right?
Alla Redko also no, because again from my own experience, I was examined without dilation on a narrow pupil and everything was fine. But considering the work with gadgets, computers, I noticed that my vision is deteriorating. And they examined me with a dilated pupil and saw changes in the retina. So I underwent full OCT examinations, and now I know which Alina Venediktova prevention methods, how to strain my eyes. There's nothing too scary. But indeed, the extended examination is more diagnostic,
Informative.
whole and informative. And there's nothing scary about it. I could even drive a car.
But they do not recommend it, right?
A taxi, they put drops in my eyes, they examined me. Well, I was going home, I could see everything perfectly. I was taking a taxi, but I think I could have driven myself.
And I will also share my experience. They also put drops in my eyes, and at that moment I was reading a book. And I was reading it with my eyes closed, and the book, even though there was noise, many people, and you have to wait for the drops. And at that moment, when your vision is turned off, when your eyes are constantly closed and you are reading or doing something, the perception of it is much better. At that moment, I decided to perceive the situation this way. But generally, when they put in the drops, it's really not recommended to operate a vehicle because there is indeed some blurriness present.
Yes, and not work at a close distance for 2 to 3 hours. Of course, the patient can read a book, but that will be all.
I have AMC.
Yes, but reading itself is not recommended, and wearing sunglasses is also advisable. If we check during the day and the sun is bright, it is indeed uncomfortable. But it's not a big deal. You can use eye drops and complete the examination fully.
Please tell me, is an ultrasound examination of the eye something that needs to be done routinely? And if so, in what cases, and is it done like that?
Not always necessary. In which cases do we perform it? For example, if a patient has cataracts, congenital cataracts, then of course we cannot assess the retina through the clouded medium. Then we perform it. But we do not perform an ultrasound examination on every patient. What is included in the comprehensive examination? Checking visual acuity without glasses or with glasses if the patient already uses them, in lenses. And by the way, patients also ask if they can use lenses during pregnancy. They can if they have experience, if they are responsible. A person will wash their hands, carefully put on and take off. Of course, with proper care, there will be no harm. Therefore, during the examination, we check visual acuity, then with glasses and lenses, perform a visual field test, optical coherence tomography, examine the anterior segment of the eye and the fundus. This is all part of the comprehensive examination. It takes approximately 1 to 1.5 hours to complete everything.
I also have a question regarding eye ultrasound. This is something new in our obstetrics. Some countries, developed countries, use eye ultrasound and Doppler in the ocular artery as a predictor of preeclampsia. That is, we are currently evaluating uterine arteries, biochemical indicators, and the patient's personal data. But the eye artery is a more accurate, sensitive, and precise method. Do you conduct this? Is it conducted?
Maybe. Let's implement it. We are a developed country. We can do it.
Thank you for the idea. So far, we have not conducted such examinations, but I think it's an interesting idea.
I think that we always strive for something new. We go and implement it. And as well as risk calculations for preeclampsia using ASD and RAI, we conduct them. It took a long time to get here, and unfortunately not everyone does it even now. But developed clinics, let's say, use it as we use it for predicting preeclampsia well, and Europe, developed countries use the eye artery, so I think we should too.
Irina Shatalová, think about it.
Svetlana Mazi, tell the viewers what preeclampsia or eclampsia is so they understand why we started talking about this topic.
Irina Shatalová, preeclampsia is a complication of the second half of a pregnancy when a woman experiences high blood pressure, protein in the urine, and swelling.
This is a very dangerous complication that can provoke us to deliver the woman prematurely at very early terms, resulting in premature babies who require accordingly a lot of resources, care, and to ensure them a quality life afterward. Well, of course, it is dangerous for the mother as it affects the functioning of the kidneys, the organs of vision, the heart, and all organs. Therefore, it is very important for us to assess the risks, to select the risk group for whom prevention can and should be conducted. After all, it's not just that we calculated the risks and know that we have risks. We have prevention. Prophylaxis with certain aspirin medications, which we need to start on time before the 16th week of pregnancy. We must start this prophylaxis for it to be truly effective and active so that we can prevent this complication, giving the woman a chance to carry and give birth to a healthy child without harm to her own health and the child's health. Therefore, this is very important. Just as we calculate the risks of genetic diseases, so too with preeclampsia, as it is quite a major leader in maternal mortality worldwide and in infant mortality as well.
Svetlana Mazi, and if there is also in vitro fertilization and cryopreservation protocol and polycystic ovary transformation, it is also stated that the risks increase.
Irina Shatalová, yes, that's right. If there are such patients, in fact, if we include in the program an in vitro fertilization, weight mostly, polycystic is accompanied by
Wait.
Irina Shatalová, excess weight. In most cases, gestational diabetes also appears. This is a very high-risk group for developing preeclampsia. The program will show us this. Preeclampsia and fetal growth restriction require prevention. The best treatment is prevention. If we don't start prevention by the 16th week, by the 20th, it will be too late. The train has left.
To these patients, this risk group of patients, definitely see an ophthalmologist. Do you somehow emphasize to the ophthalmologist, maybe highlight that the patient is in a risk group, and will you also conduct additional examinations?
Irina Shatalová, yes, of course, we send such patients for a consultation with an ophthalmologist. They are necessarily examined at the beginning of pregnancy and before delivery, so we understand if there is any impact, if there are any changes, and what recommendations to give the patient and how to manage the delivery, whether there are indications for a cesarean section from the perspective of the visual organ.
Really interesting, isn't it?
Yes, it is very interesting. Indeed, there are not many such patients, but they do exist. And on the fundus, we see serious changes in the vessels and the retina. Often it is hemorrhagic retinopathy. This is the very complication that requires a cesarean section. Yes, yes.
And please tell me if any other surgeries need to be performed, for example, cataracts or something else during pregnancy. Are they performed during pregnancy or before or after?
Well, cataract is usually in a young woman, or it's a congenital cataract, and the patient already knows about it. She has either been operated on, or it's a planned surgery that we can perform after the child is born. And if it is a complicated cataract, it is not a threat of vision loss. We can also postpone the surgery. If it is glaucoma, we try, especially an acute glaucoma attack, we try to treat it conservatively, prescribe medications.
Pregnant as well?
Yes, we choose which medication is better to prescribe. We have a lot of medications for treating glaucoma, so if there is a risk of vision loss, then yes, we must use medications to reduce intraocular pressure.
please tell us how to measure intraocular pressure and intracranial pressure. Because we recently had a request where a patient said, I want to see an ophthalmologist to measure intracranial pressure. Explain the difference to us so that we all know.
We measure intraocular pressure using a non-contact method with air, and we also have a device called ICAR. With the help of a very fine probe, we can also measure it. We don't use drops because there are many patients with allergic conditions. Therefore, the non-contact method allows us to accurately assess intraocular pressure. Regarding intracranial pressure, we do not measure it in our clinic, but there are signs that indicate an increase. These are changes in the optic nerve and changes in the blood vessels. When examining the fundus of the eye, we notice such changes, and then we refer for a consultation with a neurologist. But we cannot specify the intracranial pressure in numbers. There are only signs of increased pressure.
Well, intracranial pressure cannot be measured with such conservative methods. We can only have indications in further examinations, like a certain enlargement of the third ventricle, and this can be a sign of increased intracranial pressure plus the clinic complaint and neurological status. This is more for neurologists.
But since increased intracranial pressure is an indication for a cesarean section, I am somewhat competent in this topic.
Here we refer to a neurologist. The neurologist assesses the neurological status where they might suspect increased intracranial pressure, the patient's complaints, and further examination with neurosonography. When they assess, yes, the third ventricle, and if there is indeed increased intracranial pressure, it is called cerebrospinal hypertension syndrome. This is an indication for a cesarean section. Some women do not want a cesarean section, but we diagnose, and of course, considering the risks that may occur during the active phase with this complication, we recommend a cesarean section.
Now you see there are different categories of women. Previously everyone really wanted a cesarean section. Now everyone has become wiser and understands that this operation can have consequences, complications, everything. And well, like childbirth, it is also a complex process, but still they have divided into different groups.
Well, according to our protocol, there's no such thing as the woman's desire.
No.
We must have medical indications. And this is correct because a cesarean section is performed for the vital indications of the mother or child. Why is that? A cesarean section itself is a highly complex operation. It is not simple in terms of health risks for the mother, and it has many complications long-term when planning the next pregnancy, during gestation and childbirth. Therefore, it is very important to carefully select patients for whom a cesarean section is performed. If everyone undergoes a cesarean section, we will then have many complications with subsequent pregnancies. But not all women understand this.
Not everyone, but now they are not only interested in this, they are also interested in how the child came into this world, how they adapted everything. So now the situation is that probably understanding is somewhat improving.
There is greater access to information. Perhaps people read more and information is more accessible to them, as well as statistics, and they can listen to podcasts. Yes, specialists in this regard. Yes, where there are indications that threaten life or health, of course, are not discussed, but just the desire.
Unjustified, this can have negative consequences. Therefore, we need to be heard and also think about it, that it's not just about performing an operation. Any operation involves significant risks.
Yes, I always tell patients, Kanno, do you know that when you sign consent for a cesarean section, you automatically consent to a hysterectomy if there is massive bleeding and the risks are high for everyone? It's clear that no one will wake you up during the operation and ask, so you automatically sign such consent. Then they start to think, although this is one of many nuances, just one.
You also sign consent when certain procedures are performed, right?
Yes, of course.
What complications can there be? I understand it's a small percentage, but still, complications from any ophthalmological interventions as well.
Complications can mainly occur if the patient has hidden some information from us. That's why we always emphasize how important it is to tell us about all accompanying diseases. In general, there are risks as with any surgery, but they are minimal. We need to discuss all this with the patient and take into account, let's say, general diseases.
Could there be a loss of vision?
Well, loss of vision, no. Most likely, no.
This is very good because this is what everyone fears the most. Everyone is afraid. Everyone understands that if some manipulation is performed, it should not have a negative consequence. So that it was not a loss of vision. That is mostly.
And I also have a question about focal laser coagulation. About the patient's ability to work after the procedure, there are absolutely no restrictions, none. Yes, they can lead a normal life. There are no restrictions. The operation is performed and they can work the next day. Well, you could say it's more of a procedure than an operation.
This is very good, how much everything has changed. And I remember in my student years, they did something to us. I saw something like that, not to us, but I saw it. They put something heavy on the eyes. What is this? Tell us. Does this even exist? Do you remember something like that? This is ultra.
Yes, difficult, yes. Is it not measured like that anymore?
Well, in most cases, we measure using a non-contact method, although such a method exists.
But is it still used?
Well, sometimes they use it. In our clinic, we don't use that method because we use modern diagnostic methods.
Understood. Please tell me, can vision decline during pregnancy?
There can generally be physiological changes, for example, slight vision deterioration. The shape of the eye changes a little, the eye may enlarge, the curvature and thickness of the cornea may change, but these are all minor changes. They are temporary. There may also be a disruption in tear production, manifesting as dry eyes or conversely tearing, but I repeat, these are temporary changes, and after childbirth, all visual functions are fully restored. Significant changes can only occur against the background of general diseases, diabetes, hypertension, and other illnesses.
Have you had cases where, for example, the vision changed so much that a pregnant patient had to constantly adjust, like different glasses, change everything?
It happens, Diki. There can be minor changes, and that's why during pregnancy we don't change the correction. It's necessary for the woman to give birth, for the hormonal balance to normalize, and then we can select the next correction.
Yes, it happens indeed that it's necessary to prescribe a new prescription for glasses or contact lenses. I have a question. I have patients, for example, who have moderate myopia or mild myopia, nearsightedness, and they say, I'm afraid to give birth because I'm afraid my vision will deteriorate further.
I heard that too. Yes.
Yes, I'm afraid of giving birth. Do the intense labor period and physiological childbirth really affect it so much that they have something to fear? And won't a cesarean section have a worse effect? Because they will go looking for indications for a cesarean section. They won't bring a conclusion from someone. I encounter this often. Although I explained that the cesarean section can also have a harmful effect in such cases, not only physiological reasons, and we don't know which is worse, your opinion as a specialist. In each case, we have to consider individually the situation we have observed.
Myopia can progress, nearsightedness, yes, it can progress. Will a cesarean section affect it? Well, most likely not. Myopia itself can progress. This may be related to stress, visual strain, as well as changes in connective tissue.
After all,
the woman's body prepares for childbirth. The connective tissue changes, the ligamentous apparatus, and the sclera, this outer shell of the eye, is also connective tissue. Therefore, if there is myopia, well, even of a mild degree, and at the same time there are inadequate, very many visual loads,
it may happen that the eye increases in size, and the more the eye increases, the greater the myopia itself.
That is, well, I believe that it's not so much the cesarean section, but rather uncontrolled visual strain or other diseases. They can have an impact. So neither regular childbirth nor a cesarean section will affect the progression of myopia. The progression of myopia can occur even in a non-pregnant woman.
and it can happen in men too. So I will reassure there are such doctors because myopia is a multifactorial process. Heredity matters, visual strain, general diseases, anemia, vitamin D deficiency, many reasons. So let's say they have more influence, or a combination of these reasons can have an impact.
From anemia, vitamin D deficiency,
It also exists. It also affects the clarity of the image.
and vitamin A.
Also, we must thoroughly examine the patient and prescribe treatment.
But as ophthalmologists, do you not recommend examining the hormonal background or these microelements, vitamin D, or do you recommend it?
We recommend, and then they undergo all the examinations at their place of residence.
You see how everything depends. Everything is interconnected. We also recommend that if each doctor will recommend and examine not only their own field of vision, but also look at everything, then this is a more comprehensive approach to the patient.
And it's always like that.
I have another question. Do you know what question? I recently saw it with a doctor. He says that a patient should take tests in any area, and then he sends a list of ready prescriptions and says, but you also need to take this. And there's a standard scheme, take 1, 2, 3, and you also need this. It's like a whole A4 sheet.
Is this the correct approach to the patient?
No, of course, incorrect. We must consider absolutely everything, and each person is individual with their general illnesses, visual loads, and professions. Therefore, in each case, we must prescribe individual treatment. It cannot be standard for all patients.
Well, there, for example, the standard, like take iodine. Although iodine isn't taken like that. There's like take vitamin D, take iron, and there's a standard list like that.
This is called polypharmacy. When a patient takes too many medications, it may not be beneficial and can actually be harmful. As one of the professors said, if a person takes up to 5 medications, if they are ill or have some deficiencies that need to be addressed, it is normal. If it is more than 5, it is polypharmacy, which can bring many complications and harm to health.
And this is only acceptable if the patient is in intensive care and it's necessary to support their vital functions. Therefore, I also do not support this, although I quite often encounter patients who come with blocks, breakfast, lunch, dinner, a handful of pills. Well, mostly these are prescribed either by non-doctors or by people who have some connection to medicine but do not work in it.
Or they get a percentage from some pharmacy or something else. That's how we talk. We have a straightforward conversation here. We can say everything. There is an interest, right? So you need to be careful and remember that each person is individual. You can't prescribe a standard list to everyone and have everyone take it without knowing if it's really needed or maybe it's not needed at all.
And when you tell the patient that this can be cancelled, they are quite reluctant to agree to the change because they are used to taking it. I say, it's summer, vitamin D can be cancelled, get a little sunbathing, it will be produced under the sun. Well, preventive doses of iodine in iodine deficient areas can be taken. You can eat iodized salt and other iodized products in iodine deficient areas. And other examinations and replenishing deficiencies as needed.
Are there any recommendations on what is best to consume for good eyesight?
Moderator, yes. For vision, vitamin A, B vitamin, vitamin C, and vitamin D are necessary. They are needed.
We always provide our patients with a printout showing which vitamins are found in which foods and what they are for. So if we detect cataracts, the patient should pay attention to which vitamins are needed specifically for this condition.
Well, for example,
Host. Understood. Any recommendations to avoid straining the eyes? Like, for example, lifestyle or something? Eye exercises, something like that you can provide us?
Doctor, since the organ of vision depends on the overall condition, we always advise monitoring all general diseases and undergoing comprehensive health examinations. Regarding visual strain, the distance and duration of work matter. The distance should be 30 to 40 centimeters, no closer. At this distance, our eyes are parallel. If we bring them closer, the internal muscle turns our eyes inward, which poses a risk of both fatigue and the progression of myopia, as well as the development of strabismus.
Host, and what if you want to look like this?
Doctor, that's not good. This is not good.
Host, and the main headache.
Doctor, these are headaches, tension, accommodation, vision deterioration, lighting and work time also matter. It is advisable to take a break every 20 to 30 minutes. And if a patient works at a computer for more than 4 hours, then the 20 rule applies. Work for 20 minutes, take a 20-second break and look into the distance or sit with closed eyes to relieve tension. Spending 1.5 to 2 hours in the fresh air is essential to naturally get vitamin D. Sleep should be at least 8 hours, right? And for a woman, yes, this is very important. The eye recovery mechanism starts at 10 o'clock in the evening, so it's advisable to go to bed during this period.
Put the gadget aside.
Doctor, yes, both the phone and the computer should be set aside an hour before. Yes, we don't use gadgets. Sports are important too. That is a healthy lifestyle, emotions, nutrition, sports, and the regimen of visual strain.
Host, I recently bought glasses, protective glasses. Tell me, is it true? Do they protect from protective glasses? When host, yes, from the monitor when using various gadgets. Do they help or are they just an additional accessory?
Doctor, no, they help because they remove harmful glare. They provide a clearish image so the eyes get less tired. And if there is another issue, for example, nearsightedness or farsightedness or astigmatism, besides protection, we prescribe a prescription, the diopters needed to relieve tension, so it's easy to work. So, of course, glasses are necessary. There should be maximum protection, but the duration of work also matters.
If the glasses have maximum protection and the patient works at the computer for several hours, of course, there will be fatigue and vision deterioration, a la Pasechnik. And we also work with the device. We have the screen constantly, Maria Carragera computer, and they had very severe headaches. And well, it seemed to me that my vision worsened, and I visited an ophthalmologist. I was prescribed glasses.
I have an astigmatism, but 100% vision. It works differently, much better. Till I can't walk in these glasses. That's how it is. I only need them for work. That is when you walk at a close distance. When you walk, you see worse in them than without them. But with the monitor, it's like you wipe the glasses clean. And that's how it is with the glasses. And the head doesn't hurt. You see better. The eyes don't get as tired.
Although a slight correction, nothing, just protective and astigmatism correction. Diopters are there. Pasechnik, yes, and we also need to check tear production.
Because when a person walks attentively at a computer and if the screen is incorrectly positioned above eye level or directly during blinking, there is no full eye moisture and then the eye dries out. And also headaches, eye pain, eye redness, and vision deterioration because the tear film is like our additional lens. Therefore, if there are such signs of dry eye syndrome or computer vision syndrome, we also prescribe moisturizing treatments. And by the way, we can prescribe medications to pregnant women. They are without preservatives with the maximum amount of hyaluronic acid. We can prescribe them to pregnant women. It won't cause harm. On the contrary, it will be more comfortable because pregnant women work and they work at the computer and they are stargazers. Maria Carragera. Yes, nowadays, I don't think there's any profession where they aren't used. Ala Pasechnik. Pregnant women can also use these protective glasses.
This is a pregnant woman. She is just like any other woman. Well, of course, the load on her is great, but nowadays pregnant women also exercise, work, and do everything. Handi,
Maria Carragera, yes. Well, I have many pregnant patients who, after consulting an ophthalmologist, are diagnosed with dry eye syndrome and are prescribed these drops because it's 80% it's not a disease, right? But it's just necessary to moisturize and provide additional hydration.
And you mentioned the computer, that it should be not like this, but like this. The gaze should be slightly lower, and then when we blink, the eye gets fully moisturized. But for some of us, the monitors are positioned straight like this. And if it's a laptop, it's understandable. But if it's a monitor, it's directly in front of us.
Should that be a problem? You can adjust the chair higher, yes.
And then you will look a little lower. Mine is lower. It's uncomfortable for me when the monitor is higher, and I always raise the chair. And my nurse, on the contrary, lowers it. And when we switch chairs, I raise it. So it's uncomfortable for me when the monitor is higher or at eye level. Mine is lower. Yeah, that's probably not the right option.
It's just more comfortable for me when it's lower. And another question about lenses. It's clear that you already said pregnant women can wear lenses, but now many people just wear lenses as some kind of decorative thing, an accessory. So what do you say about this? Is it safe? Can they be worn, or is it still undesirable?
If you follow the rules of wearing them for 3 to 4 hours, then it's okay. What is not allowed? You cannot sleep in colored lenses, and you cannot wear such lenses for a long time. If it's an event like a birthday and you want to change your image, you can wear them, but use them briefly and possibly with moisturizing drops. The main thing is hygiene and wearing the lenses for the prescribed duration. There are patients who wore them once or twice, but our term is running. If the lens is opened, the usage period has already started. Lenses can be used for no more than 1 month. Liza, if you follow the rules, there will be absolutely no harm to the eyes.
Diana, and what if, for example, you open them and use these lenses 6 months later?
Liza, this is not good because there is a risk of eye inflammation. And yes, it is still undesirable.
Diana, so the one who bought lenses wore them for a month and that's it? They don't save on accessories and don't do it.
Liza, and never wear them if you're sick, if you have a runny nose, fever, even a cold sore on your lip. It's not about the eyes. It means there's an infection, there's an exacerbation now. Therefore, even regular lenses, not colored ones, should absolutely not be worn. If we prescribe lenses, we always say that glasses should also be at home for that period. If we want to rest or if we get sick, then we use glasses.
Diana, but now there are such nice glasses you can choose so well now. And tell us now that summer is coming about sunglasses, how to choose them correctly, what should they be like?
Liza, yes, sunglasses are absolutely necessary, especially for children, because the sun is very active. And scientists have already calculated that if you don't use sunglasses after 40 years, there may be dystrophic changes in the retina. So we must protect our eyes. There should be polarization, of course, and the level of protection is individual, right? There are patients who cannot use very dark glasses. Visual acuity also matters. For example, if a patient has myopia, yes, and they put on dark sunglasses, their visual acuity decreases even more. In such cases, we suggest wearing contact lenses and then putting on sunglasses, or there are now glasses with such attachments. This is a regular frame with correction, for example, -2, -3 as needed, and a polarized lens is placed on top.
Lisa, yes, there's just...
Liza, and we even use them for children. Or you can use photochromic lenses, that is chameleons, right? These are lenses that will change their color in bright sunlight. Indoors they will be light, and outside they will be dark if the sun is bright or with such attachments. This is very, very convenient, especially for those who drive. For example, they work indoors at the computer in their regular glasses and wear these attachments while driving, because photochromic lenses won't provide such darkening in the car. Just a little insignificant, so there won't be sun protection there. And with attachments, it will be perfect, although there is also an option to order prescription sunglasses. So they will always be dark with the prescription needed by the patient, like -3, -2.
Diana, for oneself individually. Lisa, individually. And these will be glasses only for a specific person.
Are there any questions? And those glasses that we buy at the Kalinivsky market or where nothing is written on them, they just have dark lenses. Are they effective?
Lisa, they are very harmful, I would say.
Yes.
Liza, yes, sometimes in the clinic, well, if a patient asks, comes in glasses, we can check the level of protection. And it happens that, yes, the glasses are very nice, but there is no protection at all. Then it's better not to wear them at all, because our body is such that we protect ourselves. When we go outside, the pupil becomes as narrow as possible, and minimal light reaches the retina. If we wear low quality glasses, our eye perceives it as darkness, and in darkness our pupil is dilated, there is no protection, and through the dilated pupil all this light stream hits the retina. Therefore, if buying glasses, they should have a certificate. It's better to buy them in optical stores, in medical institutions, not from individuals.
Diana, are they polarized there?
Doctor, SHIIT can be checked. There are such diagnostic methods for the glasses themselves. We can say whether there is protection or not, because just trusting, yes, they told us it's there, that happens. They told us there is 100% protection, but there is no protection at all. Therefore, there must be certificates. We should not harm our health.
Tetiana Mironenko, how should one know?
Doctor, these nuances.
Tetiana Mironenko, not at 30 years old, but preferably earlier. There is little information like this, for example. Check the glasses, get a diagnosis, quality glasses need to be worn. We have many sunglasses. It's just like an accessory that should be nice, and many are sold, and no one pays attention to the quality of these. Therefore, people need to understand this too. And children do not really want to wear glasses.
Well, it depends on the person.
There are children who, even with perfect vision, want to wear glasses for correction. I've had it happen more than once that children come in, deceive us, and show lower vision so that we prescribe glasses because all their friends have glasses and only one doesn't. Therefore, we have control methods by which we can accurately determine whether a child needs glasses or not. So now the trend is changing a little. On the contrary, children want glasses.
Tetiana Mironenko, I remember there used to be kindergartens, though maybe there still are for children with vision impairments, vision problems. There are still some now.
Doctor, there is a specialized kindergarten we have in the Chernivtsi region. I really like it because poor vision, some children or wearing glasses can be perceived as some kind of problem, and they refuse to wear them. And if they go to this kindergarten, they see that this problem is not only theirs, there are other children with glasses. And if a procedure needs to be done, there is such a thing as occlusion, when you need to cover an eye, and sometimes for a certain period,
makeup.
Doctor. Yes, and parents love their children very much. The child says, I don't want to, and the parents don't make them wear it. We are waiting for some results from our treatment, but there are no results. So in such a kindergarten, there is an outsider, an aunt, a nurse, who comes, closes for those who need it, closes the eye, and this occlusion is used. Then we see good results. They also monitor what kind of visual load should be. Children go to school and they already know what exercises to do, how much we work and how much we rest. So they do it all automatically. Wonderful. And earlier there used to be an elementary school at such kindergartens. Unfortunately, now there isn't. There are children with very low vision, so they adapt better, realizing that they are not the only ones with such a problem. Unfortunately, there are many children with congenital developmental defects now. This is influenced by genetic factors, heredity, visual strain, and various infectious diseases that a pregnant woman may have. And after that, we see significant changes. Unfortunately, we cannot always help, so we also need to examine children as early as possible. If it is a premature birth and the child is born weighing less than 1.5 kilograms, an ophthalmologist must examine them to rule out retinopathy of prematurity. Such a disease requires surgical treatment. If the child is examined in a month or two, there are already irreversible processes, and this is blindness. Therefore, it is advisable to check. And if the parents have an anomaly, a congenital vision anomaly, it is also advisable to check as early as possible. Well, in general, there is a specialty called ophthalmogenetics. There is a doctor who can prevent congenital developmental defects if it is at the stage of planning a pregnancy. Lilia Hrinchak.
How interesting. Do we have it?
In Chernivtsi, we don't have one. In Kyiv, there is a doctor who does it. Very good result.
Can I make an appointment?
Yes, because there is such a thing as the Ukrainian Society of the Blind. In the Chernivtsi region, there is one as well. There are many patients with low vision or blindness. They get to know each other and form families. And sometimes the mother has a congenital cataract, the father has an optic nerve defect, and the child has both. So such families can be helped and they can have completely healthy children. That is, a geneticist, yes, provides you with data for typing, calculates risks, yes.
How to prevent it? Are there any methods? Yes, there are.
In such cases, when they come to me, I refer them to an ophthalmogeneticist in Kyiv. There is an Olena Mikhailivna Savina. She is very well known in Ukraine, and she can develop a program. And or, for example, even if there is already a congenital defect, it was previously considered an irreversible process. And we have to accept, yes, that vision will deteriorate, and in the end it will be blindness. Today we can treat it. There are many free programs for children with congenital defects. Yes, and it is possible to treat and at least maintain. That is, so there is no dependency on another person. It might be a disability because there is still a congenital defect, but at least it won't be dependency. There is such a disability, subgroup A, yes, when a child requires constant assistance, but we can improve vision. Therefore, it is important to control this, yes.
Please tell me, are there any absolute contraindications to carrying a pregnancy related to the eyes?
Well, there are no absolute ones. Termination of pregnancy may occur if there is a threat, an acute glaucoma attack, retinal detachment. We have to operate because blindness will occur. So yes, in such cases, pregnancy may be terminated. If it's an early term, termination is recommended. And if it's 34 weeks, do you recommend delivering such women?
There are also risks. How much is possible? There are risks, yes. In each case, this issue needs to be considered individually.
Because I haven't had a pregnant patient with a glaucoma attack yet.
And good, so that, and let it not be.
This happens so rarely. Usually these are patients who already have congenital glaucoma, who are prepared for this, yes, who...
They probably already know about this.
But this is not a contraindication to pregnancy. It is not a contraindication, but control must be maximal because an acute glaucoma attack can lead to vision loss if not treated or operated on in time.
But if it's an early term and an acute attack, surgery is needed, and they recommend terminating the pregnancy. And why is that? Due to medication load. It's generally individual. We start with conservative treatment, and if we can significantly lower the pressure, the woman remains on medication.
And if there is a risk of vision loss, then, but there are very, very few such patients, just a handful. Well, in the Chernivtsi region, I haven't seen such patients recently. That's very good.
But there is so much modern technology now, so much can be done, prevented, operated on. Now, there are opportunities for correction in children and adults. Therefore, our viewers need to know whom to contact so that the doctors are professional and can provide good modern help, because everything is changing a lot in every profession. Therefore, I want to thank you for having such a great conversation today. We talked with an ophthalmologist, we talked with a perinatologist, we discussed all the points, and I hope you found it interesting. Write in the comments, give us likes so we can meet again and discuss more great topics.
Thank you, thank you, thank you, thanks.
We thank YUZKO Studio for the opportunity to conduct such podcasts, and until we meet again, see you!